Hi, this is Marybeth Van Horn, and this is Nurse Chat. And I thought I'd do another video with this same shirt on because I did put on makeup today. So I thought maybe this would be a good day to do videos. Anyway, that had nothing to do with any nursing subject at all. But I wanted to say that I'm here for you. And I've been pretty excited about meeting with you and getting some feedback from you and trying to figure out how to look in the camera so that I'm not looking to the side. I haven't figured that one out yet. It's been a lot of fun, but I really want to hear from you. I want to hear about your interests and your subjects that you'd like to hear about, okay? Um, in the meantime, I'm making my own subjects that I think are fun to talk about, and so now I'm looking to the side again. I hope I'm looking at you. Anyway, um, today, let's just talk about medications, okay? How many medications are too many medications? What about medications? Like what is a smart way to know if you should take a medication or not or whatever? This is the deal. Risk versus benefit. Every medication has a side effect list, correct? So, are you willing to take the risk of those side effects so that you can get the benefits of the medication, okay? So, examples of, medications that have side effects that we all know they're there, but we want to know the benefits. And so, therefore, doctors recommend that medication thinking, okay, the benefit outweighs the risk. Statin drugs, for example. The benefit is that you won't die of a heart attack, hopefully, suddenly. Sudden death from heart attack is still the number one killer. And so, therefore, the benefits of taking a statin drug outweigh any side effects that they have. The deal about statin drugs is that they, people are often on them for 10 and 20 years. And over time, maybe not even notice side effects anymore, or don't even know what notice a difference. They've been taking it so long. That's an example of just one drug. I'm not picking on statin drugs. I'm just telling you that the risk and the benefit is what the practitioner looks at. And when they think about ordering a medication, I was just talking to a doctor about natural ways of taking care of atherosclerosis, which is what statin drugs take care of, or blood sugar, or overweight problems. And the doctor and I were talking a lot. And, she said, of course, the most natural way is to change your lifestyle and to exercise and eat right and think right and all that. And she said, but the percentage of people who actually do that is very small. And so it's very unlikely. And practitioners know that. So rather than experiment along for years and years and say, well, I'm going to get into the gym, I'm going to exercise, I'm going to do better, I promise myself I'm going to do better, I'm going to do, she was saying her vote was take the drugs until you can get that lifestyle change. And she made a good point, I have to say. But I really, it made me think. I have to decide now, do I want to do something like that? Do I want to take a med for blood sugar? Do I want to take something to help me? That she says until you get that leg up, until you can get to the gym, until you can lose the weight. And we were having this conversation because I had been admitted to the hospital for chest pain. I didn't have any problem with my heart, absolutely fine. But I did, take a pause because she met with me because she was the hospitalist, and it was her responsibility to talk to me about options. And I understood them, and I'm weighing them, and I'm thinking it through seriously. And I'll be talking to my doctor more and more about this as we go. But I still want to do it naturally. That's my choice. That's what I'm thinking. In the meantime, like this one doctor encouraged me, if you can't seem to get it in the next 6 months, then you might need that leg up and just choose that route. I'm thinking, I'm just telling you that very honestly, all medications have side effects. Me as a nurse, I'm trying to weigh the risks and the benefits. And that's important. If you have questions about medications, not like I take this medication, I don't want 1,000 emails with 15,000 different medications and what you talk to your doctor about that stuff. But if you have a question about medications in general, I'm happy to help you, guide you to what the right questions are to ask your doctor. If you are considering a medication, we can maybe talk about that. But every day there are new medications on the market. There are new things that are coming out all the time. And again, they all have their risks and their benefits. And if I know it and I can help you with it, I'm happy to. If it's something out of my realm, I won't even address it. I'll just say, you need to ask a doctor. And I hope to see you soon next time with a new subject.